Okay, thank you so much, Kristen. So today I'm going to be talking about boosting immunity and the microbiome with Ayurveda and functional medicine. And this is the overview of what I'm going to be talking about today. So of course, diet is fundamental. So I'm going to be discussing 30 foods that are great for your immune system and for your microbiome. And whenever we talk about immunity, we have to talk about the microbiome because as you know, the microbiome is the trillions of bacteria, archaea, fungi, and viruses in our bodies and our digestive tract. And 70% of our immune cells are located in our microbiome. And I'm including Ayurveda today because of several aspects that really help with immunity. We're going to talk about spices, herbs and supplements, daily practices, and also this concept of Agni or digestive fire, which I think is very relevant. So we'll begin by reviewing some studies about the microbiome and immunity and COVID. And we know that with COVID-19, there's a clear link with the microbiome. So this paper was published just 2 months ago in January, and they analyzed the relationship between the gut microbiome and disease severity and also blood inflammation markers in patients with diagnosed COVID-19. And what they found was that the gut microbiome composition was significantly altered in patients with COVID-19 in the form of what's called dysbiosis. So dysbiosis is basically where you have not enough of the good bacteria and too many bad bacteria. And patients with COVID-19 had depletion in many of their good bacteria with known immunomodulatory potential that help keep the immune system in check. And interestingly, this dysbiosis persisted in patients with COVID-19 even after clearance of the virus and resolution of their symptoms. And the gut microbiome dysbiosis was actually correlated with the disease severity and the degree of elevation in inflammatory markers and cytokines like CRP and TNF-alpha and IL-10. So what that means is that the more severe the degree of microbiome disruption, the more severe the case of COVID-19, the higher the elevation in inflammation and that sort of thing. There was a direct correlation. And this suggests that the depletion of these beneficial gut bacteria can contribute to severe COVID-19 because some of these bacteria like Faecalibacterium prausnitzii, Eubacterium, and Bifidobacterium help prevent the excessive inflammation that characterizes severe COVID-19. And this dysbiosis is thought to perhaps be a factor in developing persistent symptoms, what's called the long COVID, which can persist for months after a person suffers from COVID-19. So this is another paper that was published about 6 months ago where they also looked at the gut microbiota in patients with COVID-19 during hospitalization this time. And what they found, again, was that patients with COVID-19 had significant alterations in the microbiome, showing enrichment of bad bacteria or opportunistic pathogens and depletion of their good bacteria, the beneficial commensals. And again, this persisted even after clearance of the COVID-19. And there was an inverse correlation between abundance of Faecalibacterium prausnitzii, which is an anti-inflammatory bacterium, and disease severity. So I'm actually going to have a whole slide about Faecalibacterium prausnitzii because of how important it is in COVID-19. And one thing in terms of taking a step back is you might be wondering about what's the relationship? Was it that the patient first got COVID-19 and then developed dysbiosis? Or was it that they had dysbiosis and then had a bad case of COVID-19? Well, we don't know because we don't have the answers in research, but I suspect it's a bit of both because we know that dysbiosis increases the risk of a number of other viral infections. And we know that other viruses can affect the microbiome through what's called the gut-lung axis, where the lung physiology affects the gut microbiome. So it's probably a bit of both, but dysbiosis is definitely a risk factor for multiple infections. And finally, this is a paper which looked at the alterations of the gut microbiome in patients with COVID and also flu. So specifically with COVID, compared with healthy controls, patients had significantly reduced bacterial diversity. So the diversity of the microbiome is one of the key factors that determines the health of the microbiome. And again, the COVID-19 patients had higher abundance of opportunistic pathogens and lower abundance of beneficial symbionts. And the gut microbiome in the COVID-19 group was dominated by some of these opportunistic pathogens like Streptococcus and Actinomyces, whereas in healthy controls, it was dominated by other bacteria like Rhambutia and, again, Faecalibacterium. So this is the third study where they have identified Faecalibacterium prausnitzii as playing a key role. So we'll come back to that. But when we're talking about immunity, of course, now with the availability of the vaccine, from a population point of view, immunity will come from the vaccine. But for individuals who get COVID-19 before they're vaccinated, their own intrinsic immunity matters a lot. So this was a case report of a patient with mild COVID-19, and what they found was that days following symptom onset, a large number of helper T cells, killer T cells, and B cells became active in the patient's blood samples. So the very robust immune response was key in ensuring a mild case in this person. And we know that, as Dr. Bredesen mentioned, with COVID-19, you can have the cytokine storm, the severe inflammation. So we know the mechanism of that now, and it is this NLRP3 inflammasome, which is pictured here. So this is a structure, a protein structure that's assembled in the cell in response to COVID-19, and it triggers the very severe inflammation, the out of control damage, and that is what characterizes ARDS, which is acute respiratory distress syndrome, which when you see in patients with severe COVID-19, that's what leads to needing a ventilator and ending up in the ICU. So limiting the creation of this NLRP3 inflammasome can be very beneficial in terms of immunity against COVID. So we're going to shift gears, and before I talk about some of the Ayurvedic recommendations, just give a brief introduction to Ayurveda for those who may not be familiar. So the word Ayurveda comes from the Sanskrit Ayu, meaning life, and Veda, meaning science. It's one of the oldest systems of medicine that's still practiced, and really believes that food is fundamental, as illustrated by this quote where they say, when diet is wrong, medicine is of no use, but when diet is right, medicine is of no need. And Ayurveda is based on the 5 elements concept of the universe, where the 5 elements come together to create 3 doshas or forces that are known as vata, roughly translated as wind, pitta, which corresponds to fire, and kapha or earth. And Ayurveda emphasizes the self-healing ability of the body, and also it's highly personalized. And I like to think of Ayurveda as the original functional medicine, where they really individualized everything to each person. And it's believed that each individual has a unique body type or prakriti, which is determined at conception, and that is their unique proportion of their doshas. And the vikriti is the current state of doshas that you are trying to get back into balance. And interestingly, there's modern research has confirmed that there's a basis for this prakriti or body type concept, and they've identified genetic differences that correspond to these 3 doshas or body types. And this holds true across ethnicities and different populations around the world. So it's interesting to see ancient science and modern wisdom coming together. And one of the key concepts of Ayurveda is that all disease starts in the gut. In Ayurveda, there's 6 stages of disease, and only in stage 5 do symptoms appear. So in stage 1, you have a weakening of the Agni, or the digestive fire, which is key for immunity, and that leads to the production of ama, or toxins. And it could be as a result of these factors here, like diet and lifestyle, stress, and toxins. And this is the first step in the development of disease and infections, according to Ayurveda. So we're going to talk about diet and foods in the first part of my talk, and we're going to be discussing each of these foods in detail, and then I'm going to be talking about 20 prebiotic foods that are also very beneficial for the gut microbiome. So we begin with leafy green vegetables, which all of us know are very healthy for us, but we may not know that they're very healthy for our gut bacteria as well. So there was a study which found that a certain compound in leafy greens called SQ sugars, which are sulfa-quinolose sugars, are something that is not absorbable by humans, but bacteria have an enzyme that can actually break down these SQ sugars and use them as food. And so it's basically a prebiotic that leafy greens contain. And so they're beneficial for all of our good bacteria. So in the US, iceberg lettuce is the most common form of lettuce that's consumed, but some more nutrient-dense options would be either arugula, radicchio, or loose leaf lettuce. And these are much higher in phytochemicals and also plant flavonoids. And these are compounds that can help reduce that NLRP3 inflammasome signaling, so helping to quell inflammation and keep it in check. So these are some great options in terms of leafy green vegetables. Now, mushrooms are actually, I think, underappreciated because they are able to really help a number of our keystone bacteria like Roseburia, Bifidobacteria, Lactobacillus, and Akkermansia. And they contain types of fiber that is unique in our food supply, like chitin and beta-glucans. So basically how food works is that every different food contains different types of fiber, which feeds different types of gut bacteria. And as I mentioned, gut diversity in the microbiome is really a key factor of its health. And so getting diversity of fibers in our diet is really important. And mushrooms contain types of fiber that no other food has. And they also help activate innate immune system, and they have an anti-inflammatory effect. So in animal studies, mushroom supplementation actually has been shown to correct dysbiosis, help with raising beneficial bacteria and clearing pathogens as well. So a number of, especially the Asian mushrooms, they have remarkable benefits, shiitake, maitake, those sort of things. There's a number of anti-cancer benefits as well. Breast cancer risk has been shown to be reduced by consumption of mushrooms. So I think as a group, mushrooms are incredibly beneficial for the microbiome and for immunity. So cold water fish like salmon or sardines, they talk about the triple threat, but this is a quadruple threat because they contain omega-3s, selenium, vitamin A, and vitamin D, which are all key nutrients for the immune system, can help reduce the signaling and activation of NLRP3 and help with keeping inflammation low overall. Bone broth, you've probably heard, is very beneficial for the gut microbiome. It's rich in gelatin and glycine and glutamine, as well as other amino acids that help with preventing increased intestinal permeability, which is commonly known as leaky gut syndrome. So having bone broth regularly is very beneficial. So pumpkin seeds are one of the richest food sources of zinc. And zinc reduces viral replication and may prevent coronavirus entry into cells based on studies of other coronavirus. And so you've probably heard about sometimes taking zinc as a supplement, but as a food source, pumpkin seeds are one of the richest food sources of zinc. And so that's something that I think is very beneficial for the immune system. So we know that vitamin C inhibits the activation of this NLRP3 inflammasome. And one of the best food sources, of course, is citrus, like oranges. Vitamin C in studies has also been shown to shorten the frequency and severity of colds and the incidence of pneumonia as well. So I'm including beet greens, which are the leafy tops of the beetroots. So these are pictured here from my local supermarket. Because of their effect on the liver and helping with detoxification, they contain this compound called TMG, which supports methylation and healthy liver function. And the reason is that toxins, broadly speaking, do have a suppressive effect on our immune system. We heard from Dr. Bredesen about things like mycotoxins, mold toxins, heavy metals. So if you're able to help your liver excrete toxins better, that has a beneficial effect on your immune system. Beet greens also have unique anti-inflammatory compounds like betalains and betanin that are not found in any food. And finally, they help activate this glutathione transferase, which helps your body produce more glutathione. And glutathione is the body's main antioxidant, and it's critical for phase 2 liver detoxification. So beet greens are incredibly supportive of your liver through methylation pathways and through glutathione production, and by reducing inflammation. And I think that detoxification is key to ensuring that your immune system is functioning optimally. So apple skins contain a compound called quercetin, which some studies have shown helps downregulate NLRP3 and modulate the immune system, a great source of fiber. So having apples, especially with the skin on, try to get organic, of course, if you can, would be very beneficial. Now, I've included some fermented foods here. Pictured are kombucha, yogurt, kefir, sauerkraut, and kimchi. So fermented foods are very beneficial for your gut microbiome. They contain live bacteria that help your own bacteria function better. They also contain anti-inflammatory compounds. Studies show that regular intake reduces inflammatory markers in our blood. And also, they have big effect in terms of helping diversity of your gut bacteria. So there was a study on sauerkraut that's commercially available, which found that there were almost 30 different strains of bacteria found in commercially available sauerkraut. And the way fermented foods work is they, in addition to the bacteria that they contain, they create an environment where your own bacteria can proliferate, where new species can thrive. So I'm really excited about all the research on fermented food that has come out and is going to be coming out in the next couple of years, confirming these findings. And then we have apple cider vinegar. So you always want to dilute apple cider vinegar, never take it straight because it's very strong. So you can have 1 or 2 teaspoons in an 8-ounce glass of water, and that's very beneficial for digestion and also for metabolism. It's helpful for the Agni, which is that Ayurvedic concept of digestive fire. So I think apple cider vinegar, also known as ACV, is very beneficial in that way. So I want to talk more about Faecalibacterium prausnitzii because, as we saw earlier in 3 studies on COVID, it was inversely correlated with disease severity and inflammation. So it's one of the keystone bacteria, and keystone bacteria are the fundamental bacteria in the microbiome. They help create the foundation. They are really essential. And so this bacteria is one of the main butyrate producers. So butyrate is one of the SCFAs, or short chain fatty acids, that is really critical. That's the main fuel for your gut lining, your gut enterocytes. And as a result, this bacteria has a real anti-inflammatory effect. Studies show it increases anti-inflammatory cytokines. It improves intestinal barrier function and supports mucus production in the gut, both of which help prevent increased permeability or leaky gut syndrome. And Faecalibacterium prausnitzii is an anaerobic bacteria, like some of the other keystones. So what that means is it dies in the presence of oxygen. So it's not possible to put it into a probiotic or really in any other fermented foods, but levels are increased by prebiotics. And so in the next 3 slides, we're going to be talking about 20 prebiotic foods. And with Faecalibacterium prausnitzii, studies have shown polyphenols, inulin, and arabinoxylans help raise levels. So with polyphenols, green tea is one of the best sources. Green tea has been shown to be really good for your oral microbiome, as Dr. Bredesen mentioned. I know we have some oral health professionals on the call. So the oral microbiome research on that is really exploding. It's critical as well for inflammation in the body, big connection with the gut microbiome. So with green tea, if you just kind of swish it around before swallowing, that's a good way to support the oral microbiome by giving it some of those prebiotics. So beans of any kind, black beans, kidney beans, chickpeas, pinto beans, are actually surprisingly high in polyphenols, very high in antioxidants. So that's very beneficial as well for these bacteria. And then there is one study showing that red wine helps with raising levels of Faecalibacterium prausnitzii as well. We heard about the role with moderate consumption, but the polyphenols in red wine can be beneficial. So when it comes to inulin, there are actually many vegetables that do contain high levels of inulin, such as Jerusalem artichoke, jicama, chicory root, onion, garlic, asparagus, and leek. And then finally, certain grains are good sources of arabinoxylans. So there's rye and barley. Obviously, if you're gluten sensitive, you want to avoid those two. But other grains like rice, oats, and sorghum are also good sources of these polyphenols. So with this keystone bacteria, the prebiotics are the best way to support it. And that's actually true for many of the other keystone bacteria as well. And so we're going to talk about other foods as well that support this bacteria. So we're going to do our first poll here. We're going to be doing a few polls today to make this interactive. So which of the following fruits was shown in a study to raise levels of Faecalibacterium prausnitzii in the microbiome? And so there's a few options here. There's blueberry, red grape, kiwi, or banana. So yeah, click on it should be coming up on your screen. So just click on the answer that you think is correct, and then we'll wait for for enough people to reply. And I should clarify, the study was actually an extract of this fruit. So it was not technically the whole fruit, but essentially the key ingredients from the fruit. And so let's see, can we post the results so far? What have people been saying? Okay. Okay, so we have 49% people answered with blueberry, 32% grape, 11% with kiwi, and 8% with banana. So the answer is actually kiwi. So yeah, only 11% of you guys got it. Well, it's actually true that all 4 of these fruits are prebiotics. But with this particular bacteria, there was an Australian study which showed that kiwi extract helps with raising levels of Faecalibacterium prausnitzii. So kiwi and banana are both good sources of inulin. So banana is beneficial as well as a prebiotic. Blueberry and grape are excellent sources of polyphenols. So they are good for the microbiome, very high in polyphenols, and probably beneficial for many of the other species. But specifically for this bacteria, it looks like kiwi is what is most beneficial in terms of fruits. So these are 4 more foods that are prebiotic, and all of them, of course, very, very good for the microbiome. Okay, so final food I'm going to be talking about is cocoa powder. And cocoa or cacao powder study has shown that helps with increasing bifidobacteria and lactobacilli, which are the beneficial bacteria, and decreasing opportunistic bacteria like Clostridia. And also in this study helped reduce inflammatory markers like CRP and plasma triglycerides. Of course, we know that it's very beneficial in terms of the antioxidants, and also possibly good for blood pressure and those kind of things. So with cocoa powder, you have to be careful because it might contain elevated lead and cadmium. And those are some of the heavy metals that, unfortunately, they're very prevalent in our soil. And it doesn't really matter if it's organic or fairly traded across the board, but you can read more. I have an article on my blog listed here, which talks about the how it is, what you can do to find the brands that are testing low in terms of the chocolate and that sort of thing. So there are certain brands. I think Endangered Species is one brand that has been tested, which is relatively low in lead and mercury and cadmium. And my article links to a study where they actually measured few hundred brands of chocolate and found which are the lowest. So I still do recommend it. You just have to be careful choosing the best products. So we're going to shift gears and talk about some of the Ayurvedic concepts. And again, in Ayurveda, the Agni, or the digestive fire, is considered to be the root cause of all disease. And problems with Agni can predispose to creation of Ama, which is known as toxins. And Sama Agni is basically optimal metabolism and a very healthy, balanced digestion. And that can degenerate into one of three imbalanced forms of Agni, which we're not going to be getting into today. But there are some key things you can do to improve Agni. And first thing upon arising, drinking a glass of hot water with that apple cider vinegar, and also have some lemon juice and honey. That's a great way to strengthen the Agni and begin your day. After brushing your teeth, it's recommended to scrape the tongue with a tongue scraper, because the tongue is a microcosm for the whole body, the whole GI tract. And so scraping the tongue actually stimulates your entire GI tract. It's recommended in Ayurveda to have hot food as much as possible, and especially a warm breakfast incorporating some protein is beneficial. So this is a basic point, but just chewing your food thoroughly and really being aware and mindful when you're eating is critical, because digestion starts in the mouth, and that's very important. It's also important to sit down and eat. You don't want to be eating in the car if you can avoid it, or standing, and be really aware of the taste, smell, and texture of the food. Ayurveda believes that impacts your digestion of food, and that's very important. It's recommended to have the largest meal of the day at lunchtime between noon and 2 p.m. and to have also only warm water. So it's recommended not to have ice water too much, or iced beverages, and also to have water between meals and not with the meals. I think that's logical in terms of if you drink a lot of water with the meal, it can dilute your digestive enzymes. So wait at least an hour after food to have the bulk of your water intake. And you can also chew a piece of ginger dipped in lemon juice before meals. This stimulates your digestive enzymes before getting the food. And then incorporating apple cider vinegar, and we're going to be talking about spices and oil pulling are other strategies to keep this Agni strong. And I think there's a real correlation between the Agni concept and the microbiome. So in Ayurveda, spices are really considered medicine, and there's probably 4 mechanisms for that. They're very rich in antioxidants, some of the most anti-inflammatory foods that are there. They support digestion and Agni, and also have a prebiotic effect for the microbiome. And finally, they help with your blood sugar, with metabolism, with cholesterol, and very rich in phytochemicals and nutrients. So we're going to talk about a few spices that are well known. So ginger is traditionally used in Ayurveda to fight infections, especially beneficial for upper respiratory infections. It's active against RSV, which is a virus that is a very common cause in children of lung infections. And in research, it's shown that the antibacterial activity of ginger actually can inhibit the growth of multi-drug resistant bacteria. So I think ginger is an excellent spice. Whatever form you can incorporate, as a tea, as a whole spice, as an extract, all forms are beneficial. So with turmeric, you've all heard about the anti-inflammatory effects of turmeric, but it does have significant antiviral effects. It reduces key cytokines like IL-1 beta, and also inhibits the NLRP3 inflammasome. To maximize the benefits, you actually want to combine turmeric powder with a pinch of black pepper during cooking, and that increases the absorption by 2,000% actually in one study. So ajwain, or carom seed, is lesser known but very beneficial. It looks somewhat like cumin, but it has a slightly different shape. It's anti-inflammatory, really beneficial for the respiratory system and digestion, and it has antimicrobial effects. So some of its key constituents are thymol and carvacrol, which have been shown to have antibacterial, antifungal properties, very beneficial for the digestion. So ajwain is a spice that I think is underutilized. Cinnamon is best known for its effects on blood sugar and metabolism, but also it's quite powerful in terms of antibacterial and antifungal effects. It inhibits the growth of candida, which is a pathogenic fungus. And the essential oil of cinnamon also inhibited 5 out of 6 harmful bacteria in one study. So that's excellent to have as a tea or as a powder in your cooking. So we're going to go on and talk about some herbs and supplements. And I want to clarify that there are no human trials for these products in COVID-19. And this is informational only and not a recommendation to take, which should only be under the supervision of a practitioner. And of course, none of the things we're talking about today are as a substitute for conventional medicine. So there's amla, which is the Indian gooseberry, very rich source of antioxidants, vitamin C, and phytochemicals, and significantly improves endothelial function, as well as antioxidant status, systemic inflammation, and lipid profile. So we're going to do our second poll now, and compared to simvastatin, which is Zocor, one of the most best-selling lipid-lowering drugs, a daily amla capsule had what percent to reduce ability to reduce LDL in a head-to-head study? So 50% means the amla was about 50% effective as the simvastatin. 100% means they were the same, and 60 or 80% means that the amla capsule was, that percent as effective compared to the simvastatin. So simvastatin has been around 20 years. It's like billions and billions of dollars in sales, and it was compared head to head with 500 milligrams of amla once a day in a capsule. So, so you can vote and submit your answer. So could we see what the results are in terms of how people have voted? So, okay, you guys got it right. Yeah, 100%. So, yeah, so let's see, 2% said 50%, 20% said 60, and 38% said 80, but most of you, 40% said 100%. So that's correct. In this study, the daily amla capsule was shown to be equivalent to simvastatin over 6 weeks in lowering LDL, lowering total cholesterol, and raising HDL. So pretty remarkable in terms of the impact of amla. So amla is often used to make this formula called Chyawanprash, which is a tridoshic formula that is sort of a medicinal jam. It's made from a decoction of herbs, honey, and spices, as well as adding ghee. And Chyawanprash has been studied to be beneficial for children. There was actually a 6-month-long study in children ages 5 to 12 where Chyawanprash was shown to help improve immunity and raise energy levels. It's very high in vitamin C, polyphenols, and flavonoids, antioxidants, and also has beneficial effects for enhancing immune function. So I include cod liver oil as a food, even though it's a food and not a supplement, because a very powerful, excellent source of omega-3s, but also vitamin A and vitamin D, which help activate your innate immune cells. So I'm often asked by parents for my pediatric patients, what they can give to help their children keep their immune system strong. I typically recommend cod liver oil, occasionally Chyawanprash. And then I sometimes recommend elderberry as well. So elderberry is something you've probably heard a lot about. We like to make an elderberry beverage, which is pictured here on the right, a recent batch that we made. I'm going to go over the recipe for how we produce this. We actually use dried elderberries, but studies have shown that elderberry can inhibit the replication and viral attachment of the coronavirus, a different coronavirus. And in general, it's probably effective in the prevention or early stages. And it's recommended not to be given when a patient actually has active infection, just in case there's any role in contributing to the cytokine storm. But in terms of for prevention, and also there's been studies that showed it can be helpful for influenza as well. So the infusion that we make is with 16 ounces of water and 8 ounces of dried elderberries. We add the cinnamon and ginger, and also cloves. And then you boil the water and add all the ingredients, simmer for 20 minutes, and then allow it to cool. And you can add some honey as desired. So the reason for honey is that there is some research showing that honey beat out a common cough suppressant over the counter in helping cough in children, improving sleep. There was another study also in children showing that honey was better than dextromethorphan, which is over-the-counter medicine, in suppressing cough at night. And animal studies show that honey can help heal stomach ulcers, reduce colonic inflammation, and lower blood levels of prostaglandins, which are inflammation markers in the body. So again, going back to that idea of keeping inflammation at a low level as a baseline. So ashwagandha is one of the most powerful herbs in Ayurveda. It's an adaptogen, which means it helps the body adapt to stress. And is also a rasayana or rejuvenator. So it's one of the herbs that's given a lot in burnout or in severe chronic fatigue. It helps to rejuvenate the body. Studies show it helps lower cortisol levels, which is one of the stress hormones, helps with reducing stress and anxiety, and also improves inflammation. It's not mentioned here, but it has a beneficial effect on neurotransmitters and brain function as well. So from the Ayurvedic perspective, it's traditionally very heating in terms of the quality of the herb. So it's often mixed with milk, either dairy or non-dairy milk. So there was one study that found actually consuming ashwagandha in cow's milk led to an increase in the level of white blood cell activation in the CD56 positive natural killer cells, and a significant increase in the number of CD4 positive T helper cells. So it's just confirming that ashwagandha has a very beneficial tonic effect on the immune system. You do want to use caution if you have hyperthyroidism, because ashwagandha can be supportive and strengthening for thyroid function. So if you have too much thyroid function in hyperthyroidism, you would want to avoid ashwagandha. But if you have hypothyroidism, there's no contraindication. Next, we have rhodiola rosea, which is also known as golden root or rose root. This is found in colder locales, North India, Central Asia. It's used in Chinese medicine and Ayurveda as an adaptogen, again, improves mood, fatigue, sleep, and exercise performance in multiple studies. So there are two primary compounds that are the salidroside and the rosavins that are thought to be the mechanism of action, very beneficial for lung health. And in COPD patients was shown to help improve lung parameters. Rhodiola reduces lung injury by inhibiting inflammation. So because of the effect of COVID-19 on lung tissue, I think rhodiola is a really good option to think about. Then there's tulsi or holy basil, which in Ayurveda is called the queen of herbs. Very broad spectrum antimicrobial. It's antibacterial, antiviral, and antifungal in terms of activity. Also an adaptogen, so promotes well-being and resilience, and supports detox by increasing levels of antioxidants such as glutathione, the body's primary one, and superoxide dismutase, etc. So you can have tulsi as a tea, often that's widely available, and as a daily herbal tea, it's very beneficial in these properties. And then finally, we have triphala, which is a blend of 3 fruits, haritaki, bibitaki, and amla, which we talked about earlier. So triphala is also a rasayana or rejuvenator, very high in vitamin C and flavonoids and tannins, and also unique antioxidants like chebulagic acid and ellagic acid. Triphala has a prebiotic effect, so often very beneficial for the digestion. It's often recommended in cases of constipation because of these prebiotic effects. But it also modulates the digestive and immune system and has antibacterial, antifungal, and antiviral properties, with studies showing activity against streptococcus and other pathogens. So triphala is a great option in terms of daily consumption under the supervision of a practitioner, especially if you also have digestive issues. It can really be good as a prebiotic effect and helping with cases of constipation. So now we're going to shift gears and go into the non-dietary strategies. We're going to be talking about daily practices and lifestyle. And the next thing we're going to talk about is actually sunlight. So there was an interesting study from Georgetown University which showed that sunlight directly activates immune cells by increasing their movement. So what the author said was that we know sunlight provides vitamin D, which is suggested to have an impact on immunity, but what we found is a completely separate role of sunlight on immunity. Here's a picture of my daughter getting some sunlight here. So it helps, of course, with vitamin D, but it stimulates T cell movement, which is the key finding. Plus, it regulates our circadian rhythm. And so exposure to sunlight during the daytime, even if only through a window, can help with sleep quality at night. So in the interest of time, I'm going to move through the remaining slides very quickly, but you'll be getting access to them after the talk. So nature is a key factor. Studies have shown increased number of natural killer cells in people who were in a forest versus those who stayed in an urban environment. And that can help with lowering your cortisol levels or stress hormones. So if you don't have access to nature, even houseplants or pictures of nature scenes can have a calming environment. Trying to create that healing environment at home is very important. The sauna therapy is really crucial in terms of sweating in Ayurveda. That's really critical for detoxification. Sauna bathing has been shown to reduce risk of respiratory diseases and also reduce frequency and severity of colds in both children and adults. Also reduces the frequency and severity of influenza or flu. And frequent sauna baths, like 3 or 4 times a week, can be associated with reduced risk of both acute and chronic respiratory conditions. And there are home-based alternatives now, such as this one pictured here, which are portable and they fold up when you don't use them. And it's a great way to incorporate a sauna into your home without taking up a lot of space. So nasya is nasal application of oil, which is considered a panchakarma therapy, which is the most powerful detoxification therapy in Ayurveda. And it's often recommended in allergies, rhinitis, sinusitis, brain fog, and mood disorders as well. Very beneficial for nourishing the respiratory tract. There are special oils you can get that are nasya oils. You want to do it on an empty stomach. And one way to do it is to lie down as pictured here with the head tilted back and apply 3 to 5 drops of nasya in each nostril. And then you inhale deeply. And this is considered to have a lubricating effect and nourishing effect for the sinuses and the entire upper respiratory tract. Very beneficial in allergies or dry eyes, chronic sinusitis, chronic headaches, a lot of these issues. Probably most of you have heard about the neti pot in terms of daily sinus irrigation. Another trick is you can apply a few drops of the nasya oil into the water and then use that for the neti irrigation. So that way you're combining the nasya with the neti pot. So oil pulling is a very ancient Ayurvedic practice, which involves holding the oil in the mouth for 5 to 10 minutes. And it strengthens the teeth, gum, and jaws, and also prevents tooth decay, and is thought to remove toxins from the body and stimulate the Agni or digestive fire. You can do it on an empty stomach. Typically, coconut oil is what most people use. Take a teaspoon of oil and swish and pull it around through your teeth. And after about 5 to 10 minutes, you can discard the oil. You don't want to dispose it in the sink because it could clog the sink, but dispose it in the trash. But oil pulling is a strategy that I talk a lot more about. A lot of benefits for the oral microbiome as well, which I think is really exciting. So that's a practice that I recommend regularly. So we know that stress has a big role on the immune system. It raises levels of pro-inflammatory cytokines like IL-65 and actually can increase the certain interleukins via this NLRP3 inflammasome that was implicated in COVID. Stress has been shown to increase the severity and frequency of viral infections. So when we talk about stress, the idea of placebos, I think, is really useful. So that illustrates the power of that mind-body connection. And placebo is supposed to be an inert substance that has no effect, So there was this interesting study where they told patients with Parkinson's disease in two groups. One would get either an expensive new medication, or the other one would get a cheap new medication that was, just kind of cheap, poor quality. Both people were actually getting saline injections. And interestingly, the patients receiving the so-called expensive treatment had greater improvement in tremor, less muscle stiffness than patients receiving the so-called cheap medicine. So it just illustrates that the power of expectation is really important, and there's a difference in degree of effect with placebos. If you think that you're getting something very impactful and powerful, that actually affects how your body responds to it, and these placebo responses exist in the immune system as well. So another interesting study actually looked at placebo surgery. So they looked at patients with osteoarthritis of the knee. And there were two groups. One group, the patients received traditional knee arthroscopy with debridement. Second group, they had a sham surgery where they simulated all the aspects of surgery. The surgeons were there, little incision was made, and the time of surgery was the same, but no actual arthroscopy was done. And patients couldn't tell whether they were having the real surgery or the sham surgery. At the end of 1 and 2 years, pain reduction and improvement in physical function were actually identical in patients who had actual knee surgery and the patients who had the sham surgery, the placebo surgery. So when your body believes that it should be getting better, like after you've had surgery, then often, it will get better. And this is interesting because in integrative medicine, we also often get the critique that, it's not evidence-based and we don't have studies showing efficacy. And, if we have something where it's shown to be just no better than a placebo, maybe we should stop using it. So you might wonder, well, with osteoarthritis of the knee, is arthroscopy sort of been stopped as a practice because it's been shown to be no better than a placebo? No, not really. It's still quite commonly performed. And I think when they have questioned some of the practitioners who are doing it, it's because it seems logical that it should help. But I think it's just a reminder that not everything in conventional medicine is evidence-based either. So I think we have to keep that in mind. So I'm a big advocate of meditation in terms of affecting lowering stress, because meditation can help your immune function, reduce anxiety, and lower blood pressure. And MRI studies have showed a larger hippocampus after just 8 weeks of meditation practice. And of course, meditation can help improve focus, attention span, and also inflammation levels. Sleep is critical, so shorter sleep duration increases the risk of infections. There was one study that showed that just less than 5 hours of sleep in 1 week increased the risk of developing a cold over 300% compared to individuals who slept at least 7 hours every night. And sleep deprivation increases CXCL9, which is a compound implicated in the NLRP3 inflammasome activation that we talked about pertinent to COVID. Melatonin also has been shown to inhibit NF-kappa B activation and NLRP3. And also melatonin has a lung effect in terms of oxidative lung injury. So that's why it's so important to get adequate sleep, make sure your melatonin levels are optimal in terms of their effects on inflammation and on viral infections. So just wrapping up with a few slides on the mind-body connection. So a positive attitude has been shown to have a surprisingly large effect on health. In fact, there are 83 studies showing that optimists enjoy better health in key areas like longevity, cancer survival, physical symptoms, and immune function. And studies have shown that a positive attitude appears to improve T-cell counts, natural killer cells, interleukins, and other markers of immune function. So a really big effect of a positive attitude. Exciting research on gratitude showing health benefits like better sleep, more well-being, less depression, improved relationships. And one technique is to write a short email expressing gratitude to someone in your life once a week that you maybe haven't told them how grateful you are, and being very specific about things you appreciate about them. So the key with gratitude practices is you have to be as specific and detailed as possible. So you could keep a gratitude journal or think about some things that you're grateful for at the end of your day. So you don't want to just say, oh, I'm grateful for my work and my family. You want to actually think about granular details. What was a moment in your day when you connected with your son and you felt extremely grateful, or a key moment at work? So being as detailed as possible is key for the effectiveness of these gratitude practices. So just to conclude, these are all the strategies we've talked about so far. I think diet is really fundamental, and for both the microbiome and immunity because of the overlap between them. As I mentioned, 70% of your immune system is in your gut, in the gut-associated lymphoid tissue, or GALT, and that's why it's so important to keep the microbiome strong, keep the Agni strong, the digestive fire. And Ayurveda just has a wealth of information to offer, both in terms of dietary practices, spices, herbs, and also the non-dietary practices like lifestyle techniques, meditation, nasya, sauna, those sunlight exposure, nature exposure. So all of these practices can have a big impact on your microbiome and your immunity. And I had to go quickly through my slides today, but for more information about my approach, you can check out my book, The Paleo-Vedic Diet, which has a lot of recipes and goes into much more detail about Ayurveda and the microbiome and spices and all of these factors. So I'll stop here and I'll turn it back to Kristen to take some questions. So thank you very much.